Hello everyone. So today we're going to talk about Zika virus, we're going to talk about mosquitoes, we're going to talk about pregnancy, but we're also going to focus on what you, the high school student, can do and should be doing to protect yourself from mosquito bites. So I want to start today and talk about the World Health Organization, and you'll see that WHO stands for the World Health Organization. And the World Health Organization announced on the 1st of February this year a public health emergency of international concern. We've only ever had 4, and this was the 4th. Our first one was in April 2009 when we had pandemic influenza or pandemic flu. In May of 2014, we had another emergency for polio. Then in August of 2014, we had an emergency for Ebola, and I had 3 trips to West Africa setting up Ebola hospitals and treating Ebola patients. And then on the 1st of February this year, in 2016, we had another public health emergency. And this wasn't because of the mosquitoes. This wasn't related to the virus. This was because in Brazil, they were seeing babies born with what's called microcephaly, or their heads were much smaller than they should be. And then something amazing happened, because when this announcement of this emergency happened on the 1st of February, we didn't know a lot about the Zika virus. We didn't know a lot about the Zika virus and the effects it would have on pregnant women, let alone the effect it would have on unborn babies. And on April 13th, only a few weeks ago this year, a new study was published by colleagues of mine from the Center for Disease Control in Atlanta, Georgia. And here's a copy of this paper that's freely available on the internet for you to read. And they published the first evidence that Zika virus was related to birth defects and how it affected pregnant women. So we now know, today, that the Zika virus can infect pregnant women and can somehow get into those babies and cause birth defects. And the main birth defect we're seeing is called microcephaly. And in this slide, I want to show you what a typical head size of a baby looks like. And a baby with microcephaly has a head size that's smaller than normal. And a baby with severe microcephaly has a very much smaller head size. Now, why do they have smaller head sizes? Because we now know that the Zika virus attacks the brain. And the Zika virus affects the growth and development of the brain. And when babies, fetuses that are in the womb, before they're born, as the brain grows, the head grows. Now, if you have a virus like Zika that attacks the brain, the head doesn't grow as fast, and that's why we're getting babies born with smaller head sizes. But we're also seeing other problems at the moment. We're also seeing babies that are born, and in these very newborn babies, these young infants, we're seeing problems with their eyes, with their sight. We're seeing problems with their hearing. We're seeing problems with their growth and development. And so there's still a lot we need to learn about the effects of Zika virus and the effects that it has on pregnant women and on fetuses and on newborn babies. And the way that we measure this is we take a tape measure when the baby's born. So we wait 24 hours after the baby's born, and we put a tape measure around their head, and we measure the size of their head. But it's really important that when we work with the nurses, with the doctors, with the community health workers around the world that I work with, that they all take the same measurement. So we're doing lots of courses and lots of training at the moment to teach nurses and doctors and community health workers how to take this measurement. And we can see that by putting a tape measure around the head, whether the head is normal or is below normal. And then we'll repeat this every week. And we'll repeat this for a number of years to look at the development of the baby. And this is really important. Another way that we can diagnose what's called microcephaly before the baby's born is by taking ultrasounds. Now, the emergency we have so far is so large that we don't have time to go and teach everyone in the world how to read these ultrasounds. So what we do, we get them to take an ultrasound of the pregnant woman, and then we use telemedicine like we're doing today. The same video conferencing software that you're using today, we use for them to show us what the ultrasound of the pregnant woman's baby looks like. And then we get other physicians and nurses who are much more experts in the field of ultrasound, and they help them diagnose whether the baby has a small head. Since that emergency's been announced the 1st of February, I've been on TV a number of times. I've been on CNN, I've been on the BBC, I've been on Canada CTV, and I've been on Al Jazeera. And the challenge that I've faced as a public health expert is that, like this one here on Al Jazeera, Zika virus fears, that more Americans test positive after travelling. What I want to tell you today, there's nothing to be scared about. And we have to ensure that people are educated, they're aware, and they understand what the Zika virus is, how it's transmitted by mosquitoes, how do we protect ourselves, and what we need to do to decrease that risk. And it's so important that we're not scared about this, but we take action and we do the right thing to protect us from being bitten by mosquitoes. And here's a map of Brazil. And this is where it all started, about May 2015. We've known about the Zika virus since 1947. It comes from a very beautiful forest in the country of Uganda in Africa. And it really hasn't been related to causing birth defects in babies until very recently, about 12 months ago. And it started in Brazil. And here in Brazil, you can see the red dots, and the red dots show where these babies that have been born with small heads actually started being reported in 2015. And that's why the World Health Organization in February of this year announced an emergency. And what we've seen very rapidly, very quickly, the spread of the Zika virus, not just as we've seen it before in Africa and Asia, but when it appeared in Brazil, it spread all through other countries in South America. It went to Central America. It went to the Caribbean. It's now in the Pacific Islands. It's been there before, but it's gone back there now. It's in Hawaii, for example. We've had people that have traveled to Samoa and people who have traveled to Brazil and come back to Hawaii. We don't see local transmission, so it's not in the mosquito population, but it's starting to appear in many countries throughout the world. And we're at nearly 60 countries right now where the mosquitoes are transmitting Zika virus, but not here in the United States. The cases that we've had here in the United States have just been from people traveling to any of these countries here that are colored in blue. So if we look at the information that we have today here in the United States, the Center for Disease Control in Atlanta tells us that we have a laboratory confirmed. These are people that have been sick, gone to a doctor, had a blood sample, and the blood sample's been sent to a laboratory and have tested positive for the Zika virus. We have 388 cases. Some of those have been in pregnant women. All of those cases, all of the 388, have traveled outside the US to countries with known Zika virus. In the US territories, it's a little bit different. The story's a little bit different. We've had 503 known laboratory confirmed cases. America Samoa, Puerto Rico, and the US Virgin Islands. Now, those three countries are different because the virus is now in their mosquito populations. And it's possible, if you live in Puerto Rico, the US Virgin Islands, or American Samoa, if you're bitten by a mosquito, you may be able to get the Zika virus. And we're really concerned about two types of mosquitoes. And these two types of mosquitoes are really easy to identify. The first one is the Aedes aegypti mosquito. And it's not native here in the US. It actually came from Africa, but it has been here. It does live here now in the US. And we sometimes call this the yellow fever mosquito. The other mosquito we're worried about is the Aedes albopictus, which comes from Asia. And it now lives here in the United States, and we call that the Asian tiger mosquito. And these mosquitoes in your backyard, in your home, where you live, are really easy to identify. Have a look closely at these two photos. Can you see their legs? Can you see the white stripes? Aedes species of mosquitoes have white stripes on their legs. So if you're at your house, at your home, and you see those mosquitoes and they don't have any stripes, then they're not the Aedes type. But if they do have white stripes, then they belong to Aedes species of mosquito. And they're the mosquitoes we're worried about. And the Center for Disease Control, the CDC in Atlanta, Georgia, has produced two maps. And here's the first map on the left is the Aedes aegypti, that first mosquito we looked at. And these are the states in the middle of summer where these mosquitoes have been found in previous years. The Aedes albopictus mosquito is shown on the map on the right-hand side, and you can see the states where we know they live. But that doesn't show us the risk. And what it shows us here is that there's going to be about 30 states in the US this year that are going to have the right mosquitoes to spread the virus. But they may not spread the virus, and I'm going to show you why. So first of all, let's look at and talk about a little bit about risk. If we go back to these maps that are on the CDC website, it doesn't really tell us, is the mosquito in my backyard? Does it live? Because the mosquito doesn't live at high altitudes. It lives at altitudes down where it's warm, it's hot, it's wet, and it doesn't live at areas where above 6,500 feet. And that's not shown on this map. A study that came out 2 days ago by NASA actually took all the information that we've had from previous years and started to generate maps based on risk by month. And let's look here at the Aedes aegypti mosquito, and we know in winter it's cold and the mosquito's not around. But we know that in May, June, July, August and September, can you see those dots? The orange dot is high, the yellow dot is low, risk. And it shows where these mosquitoes have been found and where we're going to see risk. But it doesn't take us down to our local level. And what's really interesting is that even though we may have the mosquito present, it doesn't mean it's going to transmit the virus. And this is why. Because in the US, the only way the mosquito can get infected is if the mosquito bites someone that already has the infection. And that's a really important message to understand. You've got to understand that for the mosquito to get infected, it has to bite someone that has the infection and they have their virus in the blood. And we all know that mosquitoes, when they bite us, they suck in blood. These mosquitoes, the Aedes aegypti and Aedes albopictus, can also transmit other viruses. And you may have heard of diseases like yellow fever. We give a vaccination for that. You may have heard of diseases like dengue. There's been a dengue outbreak for the last 6 months in Hawaii. You may have heard of diseases like chikungunya, which is a new disease for the last couple of years. And again, that's spread by the same mosquito. Zika is spread by these mosquitoes. And so this mosquito has to bite someone who's infected before it can transmit the virus to someone else. And this is how it does it. The mosquito bites a person with the infection. These mosquitoes mainly bite in the day. So we're really looking for mosquitoes that bite in the day, but don't be fooled by that. These mosquitoes can also bite at night. We get these mosquitoes here in Washington, D.C., and I know last year I got bitten when I was out having a barbecue with my family. We get bitten even when it's dark, so they're not just daytime biters. When they bite you, they suck in the blood that takes in the virus, the Zika virus. It goes down to their stomach, their gut. It then enters their bloodstream, their circulatory system, and it goes back up to their salivary glands, which is in their mouth part, their proboscis. Then, when they take their next bite, when they inject saliva, that's where the virus is. This cycle in the mosquito takes about 10 days. So even if a mosquito bites an infected person, it's about 10 days before that mosquito can transmit the virus. But which of these mosquitoes actually bite? Guess what? The males don't bite. The boy mosquitoes don't bite. It's the female mosquitoes. The female mosquitoes are the ones that bite us. And it's really important now that what we're doing in communities, and I've been doing a lot of work with high schools in South America and Central America, and even here in the US, in states like Georgia, Alabama, and Tennessee and Florida, we're getting students now to actually help us identify where these mosquitoes with white bands on their legs are actually there. Are they in your neighborhood? And the reason we're doing this is that we know that these mosquitoes don't fly very far. They fly about the length of a football field, about 150 feet. So if you find mosquitoes with white legs in your backyard, they fly about the length of the football field, and then they'll come back in the evening, and they really stay locally. And so if we can control these mosquitoes locally, then we can decrease the risk of Zika virus. This slide here shows what's been happening a lot in medicine, public health. Hospitals have been using this for years. We produce what's called infographics. And this is an infographic produced by the CDC, which focuses on not just Zika, but chikungunya and dengue. And here it is. Here, this infographic is explaining what local transmission. Remember, we talked about the mosquitoes in Puerto Rico, American Samoa, the US Virgin Islands. Local transmission is occurring in those 3 countries. Local transmission is not occurring in the US 48 states, also Hawaii and Alaska. So here, where local transmission, you've got to understand this term, it's where a mosquito bites a person who's infected. Again, we know it takes about 10 days for the virus to go through the mosquito. Then the mosquito then bites someone who's healthy, and they inject the virus in the saliva. Now, within 3 to 7 days, that person may become sick. But we know with Zika virus, not everyone's going to become sick. Only some people will. What we're having here in the United States right now is what's called an imported case of Zika. And these imported cases are where someone goes on for a business trip, goes on vacation, down to those countries I showed you on the map that are blue. They get bitten by a mosquito that has the Zika virus. Within 3 to 7 days, they may feel sick, some won't feel sick, and they come back to the US and we diagnose them through a laboratory test that they have the virus. And that's an imported case, and that's what we're seeing now in the United States. What we're concerned about is getting local transmission as we get more of these mosquitoes in spring and summer, and the potential for getting more people infected with the Zika virus, leading to local transmission. And when we talk about people getting sick from the Zika virus, they really have 4 symptoms that we're going to focus on. They get a fever, they get a rash, they could have joint pain, but not always. They could have red eyes, which we call conjunctivitis. And it's very similar to these other diseases that are transmitted by mosquitoes called dengue and chikungunya. What makes these 3 diseases unique here in the United States is these are nationally notifiable diseases or nationally notifiable conditions. So that if you're sick and you go to see your physician, your doctor or a nurse, and they test you, and that test comes back positive, by law, by legislation, they have to report this disease to the local county health department, who then reports them to the state health department, who then reports it to the Center for Disease Control in Atlanta. And that's what we mean by nationally notifiable diseases. And I've just recently come back from South America. I went to 5 countries. I saw a lot of people that were sick. And I can tell you now that not everyone had all these 4 symptoms. Nearly everyone had fever, but not everyone had rash. Nearly everyone had fever, and some had red eyes or conjunctivitis, but not everyone. So this is still a very challenging disease for us to diagnose. When you look at what do we do? How do we protect ourselves? Now, you could be sick with Zika, you could be sick with chikungunya, you could be sick with dengue, but it's really important that we have to take responsibility for ourselves and protect ourselves. And it's really important that if we have these symptoms, that over that 7-day period where we may be able to transmit the virus to mosquitoes, we have to prevent ourselves from being bitten by mosquitoes. And the ways that we can do that? Well, we know that daytime is the most likely time for these mosquitoes to bite. These mosquitoes with white bands on their legs most likely bite in the daytime, especially when the sun comes up at dawn and when the sun goes down at dusk. But remember, it's not always the case. They can bite at night time. So we've got to protect ourselves. We might want to protect ourselves with clothing, socks, long pair of trousers, shirts, long shirts from being bitten. We want to use insect repellent. And so one of the questions that I get asked, I teach at both Harvard University and Penn State University, when all our students were going on spring break, one of the questions that all the students asked me was, hey, we're going on spring break, do we put our sunscreen on first or our insect repellent on first? And it's a really good question. And you put the sunscreen on first, and then you put the insect repellent on second. And not many people know that, but that's the way you do it. Again, we can wear protective clothing, but we can also, what we can do as individuals within our families, we can mosquito-proof our homes. We can decrease the likelihood of the mosquitoes laying their eggs, reproducing around our homes, and we can decrease the risk of being bitten by a mosquito. So what the Center for Disease Control, New York has done this, Florida's done this, Alabama, California, Louisiana, Hawaii's doing this. They're putting together Zika prevention kits. And the work that I've been doing in high schools is actually helping them raise some money. We know that we can put these kits together. They have a bed net. They have these little larvicide tablets where you can put them in water and it kills the mosquito larvae. We have some DEET or some insect repellent that is known to work, and there's a list of those that we can provide. We use permethrin spray on our clothes. We don't put that on our skin. We put that on our clothes. We know that we can take our temperature in case we have a fever. We now know that Zika can be transmitted transmitted sexually from the man to the woman through semen, so we can provide condoms. And it's really interesting because high school students that I've been working with have been putting through these kits and selling them to people in their community, one, to raise the awareness of mosquitoes and the potential of getting Zika, but also to make some money. And I had some students knock on my door in Washington, D.C. just recently, and they were selling these at $20 each. And I thought, what a great idea that was. Did I need it? No, but did I pay them the $20? I sure did, because I really liked their initiative. And we started doing this in the countries I went to in South America. And the nice thing is that the Center for Disease Control has actually made this really easy for you. You make this kit, you put it in a bag, you sell it for $20, and they've even printed information that you can copy download from the website, print it out, and hand out to the families that you sell the kits to. And it tells them how to use the kit. So all the information you need is there. And again, I have two children. They're both in middle school, and this is what they're going to do on their summer break. Focus on selling Zika kits. So let's look at the mosquito life cycle. And this is really important to understand the risks of transmission of Zika. We know it's not the male mosquito, it's the female mosquito that bites us. So we only get bitten by female mosquitoes. They lay eggs in water. And what's really remarkable about these Aedes mosquitoes is that they can lay their eggs in a very small amount of water, and the eggs can either hatch or they can survive for many, many months. And we know here in Washington, D.C. that we have mosquitoes that lay their eggs, they survive the winter, they survive the snow, and they're still there in the spring and the summer, and they hatch out. Usually these eggs, though, they hatch, in a few days, in a few days to a few months, and they produce what's called larvae. Those larvae within 5 days turn into a pupa, and those pupa then live in the water and they develop into young flying mosquitoes in 2 to 3 days. It then takes a few weeks for those mosquitoes, those flying mosquitoes, then to mature where they can actually transmit the virus. But if you understand the mosquito life cycle, then you also understand the second opportunity I want to give high school students and things that you can do. And one of those you can do is help the local county health department or the local mosquito vector control program in identifying where there are eggs, where there are larvae, where there are pupae, where there are young adult mosquitoes hatching in water, and where there's actually mosquitoes with white bands on their legs actually biting people. And you can see the 5 photos here show you those life cycles. And so what we've done through our community engagement, through using high school students, we've actually started programs where they can go out and help the community. And it's really important because we know how to control mosquitoes. We're just not really good at it because we don't pay much attention. But this year we've really got to focus on how to control the mosquitoes because we have this risk of this Zika virus. And we know that pot plants can have water. We know that there are swimming pools. We know there are areas that are like car tires that contain water where the mosquitoes can breed. We know that if we see any water, we have to drain it out and tip it out and get rid of it. We know that we put flowers in vases. Over a very short period of time, mosquitoes could lay their eggs there. We know that any barrels, containers, buckets that we have in the backyard or the front yard that have water, we have to put a lid on top of them. And we also know that we have to protect our homes, whether we've got air conditioning or we don't have air conditioning. How do we put insect screens on the wall, on the windows, on the doors, and keep them closed to ensure that mosquitoes don't come inside? So here in the US, at every county, at every city, in every town, there are mosquito surveillance programs ongoing right now. And they could really use your help. And from the 5 countries I went to in South America, they had mosquito surveillance programs, and we engaged the students from the high schools down there to actually help those programs. And what these mosquito surveillance programs do, they estimate the number of mosquitoes, the mosquito abundance in the area. Remember, these mosquitoes only fly 150 feet, or about the length of a football field from where they actually breed. So they don't fly miles. We use the estimates by counting the mosquitoes in their life cycle, eggs, pupae, larvae, and adults, and we indicate this levels of risk at the local neighbourhood level. And then we do this maybe every day, every week, so we can compare the results over time and location, and we put them on maps. So again, you could take a real important role yourself in your community, in where you live, by helping your local county health department or your local mosquito vector control program by doing larval and pupal surveys. There's little traps that we can buy, and we can get that catch eggs, and we can also get sticky traps that catch adult mosquitoes, and we can identify, do they have white bands on their legs, and if they do, we report them. And what do we do with that information? Well, we've had mosquito diseases that have been transmitted by mosquitoes. We've had them for years here in the US. We had West Nile virus. And here's a map of New York where not just the government, but also the schools in New York help set out some traps and help set in information every day. And the way they did that, they used their cell phones. And I'm going to show you how we use cell phones to send in that really important information that's needed. And this is a map of New York, which showed where the traps were laid out for West Nile virus. And they took all that information every day and they produced these heat maps. And these maps here are risk maps. And you can see the darker the colour, the higher the concentration or the higher the number of mosquitoes. So therefore the higher risk. And places like New York City, New York State, places like Florida, Georgia, Alabama, California, Hawaii are producing these maps every day to show us the risk. So again, you could participate and help identify mosquitoes on a daily basis and then call in to the county health department and let them know the results of what you find. The third project we set up in South America with high school students was that we know how to kill mosquitoes. We use insecticides. But the big problem we have is sometimes over time, when we use the same insecticide over and over again, we get what's called resistance. And mosquitoes who develop resistance don't die that well from using the insecticides. So one of the projects we set up with students was taking a glass jar, capturing mosquitoes. You put the insecticide around the glass jar, catch the mosquitoes, and you leave them there for an hour, and then you count how many of those mosquitoes died. And if they die, then we show that the insecticide's working. If they didn't die, then we've got to call the county health department and say, hey, look at this, the mosquitoes didn't die. And we've got to work out why. And that's information we can provide. It doesn't cost much money to get a glass jar and conduct these experiments. So it's a really good science experiment. The Center for Disease Control has actually published the protocols, the procedures of how to set up these experiments. And this is a picture taken from the manual that's available on the website, available online, to do this. And I want to give you a real-world example now. This is Orange County in California. This is their vector control program. And taken from their website this morning, they have a big sign-up. We need your help. And they want every citizen, they want every person throughout the whole neighborhood, throughout the community, to report that if they get bitten or they see mosquitoes biting you in the daytime, to ring this number. And that's a really good idea. And we're seeing counties and towns and cities throughout the country do this and set up these programs. But the thing is, high school students, a lot of you have the phones. So why do we want to make a phone call? Why don't we use an app? Why don't we send a text message? Why don't we use social media? Why don't we use Facebook or Twitter or WhatsApp? And this is really important for Ebola disease. For the nurses to communicate, we used WhatsApp. What we've set up now for students is using an app to actually report. So you don't actually have to make a phone call and talk to a person. You can actually just record it on your phone like a text message and send it in to their surveillance system. And this is what we've got. And so the app that you can download, you can put on your phones, looks something like this. And it'll have your name, has your address, has your phone number, tells you, well, my property or my house. Are there dogs on the property? Because that's really important. When the mosquito control people come out, they want to know whether there's dogs in your yard, so they don't get bitten. Where did you see the mosquito? Oh, we saw it around the oak trees. maybe you might have got a photo of it. If you've got a photo of it, you can send the photo on the app. And it's really important that we know the location of where you are when you send in your report. And many of us don't have to try very hard to send in the location because there's this really cool app. And I want you to Google this. Whenever I give homework to my son and my daughter who are in middle school, and I try to tell them, let's do your homework, they go, Dad, can't we just Google it? And so what you can do, if you can Google what 3 words, and what 3 words is on the website, has a website, it also has an app, what 3 words has taken the world and has divided the world up into squares that are 9 feet by 9 feet, and they've put 3 words for every square. Now, to cover the whole globe, it takes 57 trillion squares. So they have taken 57 trillion squares, 9 feet by 9 feet, given them a 3-word identification, and you can now use their app to identify where you are when you see a mosquito, or when you see an egg, or when you see pupae or larvae, or something else you want to report. If you sent me those 3 words to my phone, I would then be able to identify exactly where you are, where your square is, 9 feet by 9 feet. And we use this all the time, and it's a really easy way for us to put information on a map, and it's called What 3 Words. So in Orange County, this is what they're doing. As people either call in information or send in information, every day they're making maps. And this is one of the maps. And as you can see, the red areas is where this Aedes aegypti mosquito is being found. And the yellow areas is where Aedes albopictus mosquito is being found. And they put this on the internet, on the website, so that every person in the community can check this website and they know where the mosquitoes have been found the previous day. So I've given you a couple of projects that high school students can do. I've given you a couple of ways that you can make some money over the summer. I just want to talk about, there are lots of things that we know, but there's still many more things that we don't know about this Zika virus, and we're learning every day. So just to summarize what we know, Zika can be spread from a pregnant woman to her unborn baby, the fetus, during pregnancy. We know that. We now know, as of April 13, this is only very new scientific information, that the infection in pregnancy can be linked to birth defects. But there's still a lot to learn about that. We know that the Zika is spread mostly by the bite of an infected Aedes species mosquito. These are these mosquitoes with white bands on their legs. And even though these mosquitoes mainly bite in the day, they can also bite at night time. We also know today that the Zika virus is not locally transmitted by mosquitoes in the US 48 continental states. It's not in Alaska, it's not in Hawaii either. But we do know those mosquitoes are found here. And because these mosquitoes that spread Zika, or can spread Zika, are found through many countries throughout the world, we're going to see many more countries experience Zika outbreaks. The last thing that we know is that there's no vaccine for Zika, and there's no medicine or treatment for Zika. We have to treat the symptoms, but there's no actual cure for Zika. And that's really important to understand. A couple of things that we don't know and that we're researching on, that scientists are working on right now today. When is there a safe time during the 9 months of pregnancy to travel to an area with Zika? When is there a safe time when you might be infected with Zika over your 9 months of pregnancy? We don't know. If you do travel to an area where there's local Zika transmission and you're bitten, we don't know how likely you are to get Zika. We can't tell you that. We just don't know. And we also don't know that if you're female and you're pregnant and you get bitten, we don't know how likely your baby is to have birth defects. We have seen birth defects. We're very concerned about them, but we don't know how likely you are to get for your baby to have birth defects if you're infected by the Zika virus. And this is really important. So when I went to 5 countries in South America to help hospitals, to help patients, to help the doctors and the nurses, and I worked with high school students, we came up with some programs. And it's really easy because we have phones, we have the internet, we have ways of communication. So for all of us, it's easier than ever right now for us to communicate, collaborate, connect, and it's essential for us as citizens in the United States to actually help our government to help our local health department, to help our local mosquito control program, to provide them information that they don't have the resources to get on a day-to-day basis, and we can do that really easily. So thank you everyone for listening.
So
do we have any questions or comments for Dr. Macgregor-Skinner?
Can I hear you, Fred?
They're muted right now.
Who's gonna ask? We have a question.
Who's supposed to ask?
We have a question. Who's gonna ask the question?
What's the question?
In the back. Can you stand up so he can see you? We have to do what? Okay. No, he can do it. You can talk right there. The mic is here.
Speak loud and clear.
And if you want him to see you, babe, look at the camera. See
Happy
the camera
birthday,
right there?
Javon.
You see?
Yeah.
Okay.
Happy birthday.
Go ahead.
All right. Is it more likely for people to get bit by a mosquito?
Like, who's more likely?
Like, how can I put this? Is it likely in Los Angeles for people to get bit by a mosquito?
That's a really good question, because only a few years ago, these types of mosquitoes weren't really found in California, but they have been recently, and they have been when we had the West Nile virus outbreak. So we now know, and in California, we call these invasive species of mosquitoes. And so it's really important, like in Orange County and LA and everywhere else, that we actually get together as a community and we try to help the local county health department and the mosquito program to actually identify where these types of Aedes mosquitoes, the ones with the white bands, are actually where they are, because we really don't know. And we need to get all that, we need to give as much information as we can. Now, when you have these mosquitoes, the mosquito doesn't pick who they want to bite. They just bite us. They'll bite anyone. And what's really interesting, these mosquitoes only bite people. And it's so, no matter if we're outside and the mosquitoes in the area, they're going to find us. And when they find us, they're going to try to bite us, especially during the daytime. So it's really important for this spring and this summer that we, first of all, we identify where the mosquitoes are. And if they are, we try to prevent them from breeding and from being where they are. So we try to control them. We need to prevent them from laying their eggs, and from those eggs, as I showed you the life cycle, from going through that life cycle. But if we find adult mosquitoes with white bands on their legs, one of the really cool things we can do is set up a program to help the county health department, like Orange County is doing, to actually report, and it's called like citizen reporting. We could report every day that whether we did or did not find mosquitoes around our house. And that's really important, because we know that if the mosquitoes are there, we go outside, they'll find us really easy, and they're going to want to bite, because they need to bite us to get that blood.
Thank you. Good question. We have another question.
Well, you said that mosquitoes only bite humans, but in one of your slides, you were like, make sure there's not a dog outside. What would happen if there
Well,
was?
the dog is going to attack the person that may be coming to look at the mosquito.
Oh,
But
okay.
I wondered that too. So they don't bite animals. They only bite humans.
What?
Evolved over time with people. And wherever we've moved, that mosquitoes follow us. So this is a mosquito that has evolved to live with us. The Aedes albopictus is very similar, but it is a little different. It does bite animals. It will bite our dog. It will bite our pet cat. But we don't know what the role, or whether there's any role at all, is Zika virus can affect our dog and cat. We don't know that. And we don't know whether whether the Zika virus actually can be transmitted from a dog to a mosquito. We don't know that, and it's highly unlikely. What we're really concerned about is the mosquito biting an infected person, a person with Zika virus in their blood, and then being able to transmit that virus to someone who doesn't have the Zika virus. And so we're really worried about the mosquitoes biting people at this stage, and we're really worried about the numbers of mosquitoes we're going to get over summer, and we're going to get a lot. And that's what we're concerned about.
one more question. Can I ask, like, why do mosquitoes bite humans? Can I ask that?
Yeah, I want to know if there's any food we can eat
Yeah.
to prevent them. Can you ask?
Is there any food that we can eat to prevent mosquitoes from biting us?
Well, that's a great question. There's been a lot of discussion about this. There hasn't been a lot proven about it. Again, it's like, how do you keep zombies away? Is it we'll put garlic around our necks? I'm not really sure. Some people say, if you take certain vitamins, that might keep them. That's not something we recommend. But what we do recommend is that if you're outside, wear long sleeve shirts, wear trousers. Because these particular mosquitoes, they like to bite you on the ankle. And if you get this is what they'll get. They'll find you and they'll try to bite you on the ankle. It's really important on any area that you have exposed. Use approved insect repellent. Follow the directions on the back of the insect repellent. On your clothes, use that permethrin spray. That's part of your Zika prevention pack. Put that in your pack. This is how you're going to make money over the summer holidays. Trust me, you really will. And it's really important that at night we try to keep the windows closed. If we have air conditioning, we turn it on. If we don't, keep the windows open, but make sure we have screens on the doors. Because what happens is when this mosquito bites us, they can't fly very far. They can fly about 3 feet because why? They're big and fat and they're full of blood. And what they have to do then is sit on a vertical surface for about 30 minutes to allow the water and the protein from the blood to separate. And so that's why when you wake up in the morning, you might see mosquitoes on the roof or on the walls, and they don't fly very fast. They're really easy to kill because they're full of blood. And so it all happens locally. This is really important that to prevent mosquitoes, we have to take these actions that I outlined around our house. And that's really important to do.
So, how much blood do you think they take from us?
Not very much. Have you ever been bitten by a mosquito?
Yeah.
Did they take much blood?
Yes.
They did. No, they don't take a lot of blood, but they need that blood because they need that protein. That's their food. That's what they need, and they need that protein because for the female, and it's only the female mosquitoes that bite us. They need that protein before they can lay their eggs. So it's really important. There are many ways we can break the life cycle. So yes, do I think I'm going to get bitten by a mosquito in Washington D.C. this year? Of course I am. I get bitten every summer. I can't avoid it. What I can avoid, if there's anyone in my neighborhood, if there's anyone in my street that may have had Zika, they need to stay inside for at least 7 days and not get bitten. They need to tell us so that we know that we have to be more vigilant, we have to be more proactive, we have to take certain actions, we have to increase and strengthen what we need to do, and we have to ensure that, even though we enjoy the outdoors, use the insect repellent, wear the proper clothes, spray your clothes with permethrin, ensure that you don't get bitten. And if you decrease that risk, then you decrease the likelihood of the Zika being transmitted and you decrease your personal risk. And this is all about you. You decrease your individual risk from getting the Zika virus.
Oh, I have a question. Why do you think cases of microcephaly only started appearing in 2015 even though Zika was first discovered in 1947?
That's a great question, and we've been discussing this now in the meetings. I'm on the World Health Organization Zika risk communication team, and we meet twice a week, and we're having these discussions all the time. We thought it might have been environmental toxins. We thought it might have been related to maybe other problems like we've seen microcephaly before. We see microcephaly in mums that don't have good nutrition. Severe malnutrition can lead to microcephaly. We've seen. I saw 3 babies just recently in teenage mums and the babies had microcephaly, and the mums had been drinking alcohol throughout their pregnancy. So we know alcohol and drug abuse can lead to microcephaly. And so when we first saw microcephaly in Brazil, we didn't really believe that a virus transmitted by a mosquito could actually do this. So when we had on this hand we had Zika virus, over here we had microcephaly, these small heads in babies. And we didn't know there was a relationship. And it's only recently that we've actually found that the virus can get into people, get into these pregnant mums, and actually can go from the blood through the placenta into the baby. And we've seen now evidence that the Zika virus has been in these babies and it attacks the brain. And there's still a lot of questions to answer. Why is this not happening in 100% of all the mums and all their babies? It's not. It's happening in a very small percentage. What makes these small percentage of the mums that are having babies with microcephaly, what makes them different? And at the moment, we don't really know.
Another question from Hawaii. I was wondering, how exactly did the virus get its name?
Oh, it comes from a really beautiful forest in Uganda, and I've been there. So if you go to Uganda, Uganda's a country in Africa, there's a forest called the Zika forest. Now this virus lives in monkeys. And so we know the virus lives in the monkeys in the Zika forest, and we believe the mosquitoes had bitten. You know, they took a blood meal, they bit the monkeys, took blood from the monkeys, and the mosquitoes got infected. And we've known this. This happened in 1947, where the first people got infected by Zika, and it actually came from the Zika forest in Uganda. But these mosquitoes are so good at travel. They can travel on planes, they can travel on ships, and these Aedes mosquitoes, especially this Aedes aegypti, has really evolved to live with us. It loves car tires. It loves breeding and laying its eggs inside car tires, and there's car tires all over our community. It loves laying eggs in buckets of water. It loves laying their eggs in bird baths. And so wherever there's little bits of water, these mosquitoes have adapted to lay their eggs in very tiny amounts of water, and those eggs survive and hatch. And so it's really important. It came from Africa. We believe it hasn't caused any problems, but it went to Asia. We saw outbreaks in Asia. It didn't cause microcephaly. It's only recently that we're now seeing these birth defects in babies. So again, this is an area of research that both here at the National Institutes of Health and the CDC are really actively involved in.
Another question. Is there any progress in finding a cure for Zika?
Yes, that's a really, really good question. And again, a lot of the times when I deal with public health emergencies like Ebola, now I'm dealing with Zika, the first thing that our government, our politicians ask us, do we have a vaccine? And we didn't have a vaccine for Ebola, and right now we don't have a vaccine for Zika. But there's a lot of clever scientists out there that are doing studies right now trying to develop a vaccine. But when we develop a vaccine, we have to ensure that it's safe. And that takes a series of trials. We call these clinical trials, and it takes time. So even now, with the science that we have, we can develop a vaccine, but it's not going to be commercially available. It's not going to be available for you and I to take for a number of years, because that's the process, that's the cycle we have to take through these trials to ensure it's safe and it doesn't do more harm than good. So yes, we have the science, we have the ability to develop a vaccine. It's just going to be a few years before we have that vaccine available for us.
We have a question in LA. Okay, why is it that the female mosquito bites and not the male mosquito?
That's a great question. It's because she needs the blood to lay her eggs, and she takes the protein out of the blood, and so she needs that meal. The male mosquito doesn't need that because he doesn't lay the eggs. So what happens that all mosquitoes, and there's about 3,500 species of mosquito throughout the world. There's about 300 of these species of mosquito that actually transmit diseases to people. In this particular case, we're really concerned about these Aedes species mosquitoes. And again, it's the same across with all mosquitoes. It's the females that need to take the blood, to get the protein from the blood, so that they then go and lay their eggs. And that's what they need. And so that's why the female mosquito bites. And the thing is about these Aedes, especially the Aedes aegypti mosquito, and it's evolved with people, it's a really aggressive biter. It doesn't just bite you, it'll bite the person next to you, it then bites the person next to you. It will bite multiple people on the same day. It won't just bite one person, it could bite many people in the same day if they're in the same backyard, the same front yard, the same local vicinity. So they will just keep biting and keep taking blood meals, even in the same day.
I have one more question.
I have another question. Oh, sorry.
It's okay.
If you have Zika virus during your teens, is it going to affect your pregnancy in the future?
That's a really good question. And at this stage, we believe it doesn't, because what we're finding is that people who have the Zika virus are sick for no more than 7 days. And after 7 days, we've found that the actual virus is no longer found in the blood. And so we believe right now, with the evidence we have right now, that there's no long-lasting effect from Zika virus. unless you're pregnant and you get bitten and infected while you're pregnant. Then we're concerned. But and right now, I just had a phone call from a school in Chicago, and they said, "Hey, we're going down to South America for our school trip. Should we leave all the girls behind and not take them?" No, you shouldn't do that. Again, you've got to go and enjoy your school trip. Don't cancel it. Go and enjoy the school trip, but ensure that you're protected and you follow the recommendations for protecting yourself from being bitten. If you get sick, we know, and this is what we believe right now, there is no long-term lasting effect. Again, we're still researching this, we're still asking the same questions, and many doctors and nurses and scientists are asking the questions, so it's really important that we understand, but at this stage we're saying no, there's no long-term lasting effect. So that's a really good question. What we have found, which is really amazing, is that we have found that the virus in men, even though it's not found in their blood, the virus can be found in their semen. And so what we're recommending now, if a man gets infected, he shouldn't have sex, or if he has sex, he has to use a condom for at least 6 months. And that's the recommendation for the Centre for Disease Control right now. It may change as we learn more.
Okay, my question was, what are the fatality rates of babies who are infected with Zika?
That's a really good question, and we know that we have in the United States every year about 4 million babies are born every year. We know that even before Zika, there's about 2,500 of those babies that have microcephaly, and we have many years of information, many years of data that shows that about 2,500 out of about 4 million babies born every year. Many of those babies go on and have normal lives. Many of those babies have maybe some developmental problems, but it's not severe. When you have severe microcephaly, like a Down syndrome baby, they need support for the rest of their life. And so it's really important that what we're seeing now is that even some babies that are born with small-sized heads at birth are actually doing okay. They're doing well. They're not having long-lasting effects. But there's these other babies that have severe microcephaly, severe small-sized heads, which means they have severe small-sized brains, and they need support. And they're having also other problems with their eyes, problems with their vision, problems with their growth, problems with their balance. And it's really important that we have the programs in place to support those babies, support those mums and dads and those families. And that's what's really important. And so we're really worried about this in countries where we're seeing an increased number of microcephaly. Does the program at the hospital or the community, are those programs in place to support those mums and dads with a baby that needs a lot of support? And that doesn't always happen.
We have a question from Hawaii. Do you think that just like the influenza, the Zika virus can go through mutations since some cases of Zika are different from another?
Yeah, that's a great question because, again, this is what's called an RNA virus, and we know that with all these RNA viruses, they mutate, they change 1 million times a day. Does that mean anything? We don't really know. Does it make them more infectious? Does it change the outcome in babies? Not really, but we're monitoring this. So it's really important that we have laboratories, we have universities, we have scientists that are monitoring the Zika virus in many countries, because the big concern is that it's gone to nearly 60 countries now since 2007. It's gone to nearly 45 countries in the last 12 months. So it's going through that cycle of mosquito to people, mosquito to people. And every time it goes through that cycle, it has a chance to mutate. And it's really important that we stay on top of this to monitor any mutations. If we find a mutation, then we have to do more research and understand what does that mutation mean. So again, this is a concern we had. This was one of the hypotheses. This was one of the ideas that was posed back in Brazil last year in May 2015 when Brazil said, hey, we've got increased cases of Zika in people, increased cases of microcephaly, small-sized babies being born with small heads. We didn't know whether was this because of a mutation, and we're not. And so we're still studying now, and we can do this what's called through genomic sequencing. We do a fingerprint of the virus, and we see whether the virus has mutated. And again, we have to work out if that mutation actually is going to cause any problems. And that's what researchers do every day right now.
Well, from King Drew, we'd like to thank you, Dr. Macgregor. It's coming to the conclusion of our presentation for today. Would you guys like to say something?
Thank you.
You're very welcome.
Thank you for warning us and giving us what we can do, right?
Thank you so much also from Hawaii. Thank you. We learned a lot. Thanks.
You're very welcome.
Oh.